So Dr. Riley's finding tender spots. She might find trigger points or adhesions throughout my pelvic floor, and she'll hold them and let them release. Hi guys, Dr. Allison here with Body Motion Physical Therapy. I thought it would be a fun experiment to put out to you guys what a pelvic floor assessment looks like. And so Dr. Riley is going to do a pelvic floor assessment on me, and we're going to video this so you guys can see what a treatment session looks like. So when Dr. Riley goes to do this, she's going to have me take my pants and underwear off. I'm going to lay on my treatment table here, and I'll be draped with this sheet over me. So you'll see what that looks like. She is going to look for the ability of me to be able to contract, relax, and bulge my pelvic floor, okay? And then she's gonna insert a finger into the vagina and check these different layers of muscles. She might check my contraction, she's gonna check my tone. We'll kind of talk through what this is gonna look like and what she's looking for. So yeah, and if you have questions, of course, drop them in the comments or email us. This is gonna be my actual treatment session because Dr. Riley is my pelvic floor physical therapist. So this will be more specific to me, but it's really just a good idea and a barometer for what this looks like for when you come in for your session. I'm gonna undress privately. So I'm gonna lay down here. Excellent. Patients wear face shields. Hi guys. We have Dr. Riley here. I'm just grabbing some gloves and some lubricant here to get started.
Dr. Allison, do you want me to move the sun out of your eyes? Is it okay?
I'm actually loving it right now.
Okay, wonderful. Yeah. Soak it up while you can.
Exactly.
Perfect. I'm gonna get Dr. Allison all comfy here. If you would lift up your left leg for me, I'm gonna put this bolster underneath. You can relax the left leg there. Wonderful. And if you could shift your hips just to this side of the table. Wonderful. Okay. Then I'm going to have you bend this leg up. Beautiful. Okay, great.
I'm trying to stay draped for this. I'm going to do some nice breathing here.
Good deep breathing in through the belly. Just going to put my gloves on. Beautiful breathing. Okay, Dr. Allison, so before we do the internal assessment of the pelvic floor, I'm just going to check externally. Okay, is that all right?
Yep.
Okay, thank you. So I'm going to lift the sheet. Okay, and then I'm going to ask you if you could do what you think a Kegel is, or a contraction. Great, and then relax for me.
Ooh, I got my inner thighs going.
Yes,
there.
I know.
Okay.
Gotta relax.
Let me try that
relax
again.
Whole body.
Okay.
Do a Kegel for me. Good, and relax. Awesome, and then if you could bear down or fart, and that's totally okay if you do, because that's what I'm asking you to do. Good, and relax. Okay, awesome. Thank you. Okay, so to start here, I'm going to come to the first layer of your pelvic floor, and you're going to feel me spread your labia and insert my finger. They might be a little chilly just because the lubricant's a little cold, okay?
Thank you.
Okay, you're going to feel me spread here. Just focus on your breathing.
Okay.
And I'm just going to do that first layer. There you go. Good. I want you to totally relax your whole body. I'll take your leg for you.
One important thing that you guys should know, and you know, as I'm the patient here, Dr. Riley is my therapist, so she's treated me many, many times. But one of the things we always say is, we say if at any point you are uncomfortable or you just feel like stopping for the day, we stop. We can end it wherever you want, because you might not be up for a pelvic floor treatment, and that's totally okay.
How are you feeling with this muscle right now?
Yeah. So I'm having some definite burning here.
Okay.
But it's almost like a relief as well.
Okay, great. Let me know when that feeling starts to fade.
It's definitely faded.
Wonderful. Okay. Keep that nice breathing going. I'm gonna move my finger and assess another one of the muscles over here. Good. What are you feeling here with this muscle?
Definite tenderness.
Okay. And please let me know if I need to let up on my pressure at all.
Okay.
And I'll take your leg, just completely relax.
After the last session, when you treated this side, when I was having that, like, it was burning during the session, I definitely had soreness right through the labia the next day. But it felt like orgasm was better, sex was better. So it was like everything, it was definitely helpful.
Oh, just releasing some of the tension in the tissues. That's good. Yeah, good. Has this guy faded at all, the burning?
Yes, it's completely gone.
Okay, wonderful. I'm just going to move up here. Assess this guy. How are you doing up here?
Good.
The top.
Yeah. that's referring for me across like up to kind of my right hip a bit.
Okay.
And to my pubic bone.
Perfect.
So Dr. Riley's finding tender spots. She might find trigger points or adhesions throughout my pelvic floor, and she'll hold them and let them release. You might be thinking, well, you're a pelvic floor physical therapist. Isn't your pelvic floor perfect? It's definitely not. I have had 2 kids, and I actually had a pelvic organ prolapse before I had kids. And what that means is my bladder is a bit descended. So sometimes, even though I do the exercises, sometimes I get off my exercise routine, sometimes I increase my intensity in what I'm doing in my life. Sometimes my weight fluctuates. This all affects my prolapse and my symptoms that I get with my prolapse, which can discomfort with deep thrusting in intercourse, and with sometimes I'll get occasional incontinence when my symptoms of my prolapse are increased, or I'll feel pressure. And so I have to get tune-ups of my pelvic floor just so I feel better. And you can treat yourself, but it never really works the same as when someone else is identifying the issues and helping you work through these trigger points and adhesion. My babies are 5 and 3, and so my scar tissue has resolved pretty much. You don't really feel much scar tissue.
Not too much scar tissue.
Yeah, but it's just still like balancing the muscle tissue and all that good stuff.
Okay, Dr. Allison, I'm going to come to the second layer of your pelvic floor. Okay, so take a deep breath for me here. I'm just going to come to the second layer.
Okay.
Apply a little pressure downwards. You let me know what you're feeling.
I don't feel anything there.
Okay, great. Good.
Right there feels
Right
like
there?
Yeah.
Okay. Let me know when that starts to fade. Just focus on your nice deep breathing into the belly. Try and relax. Do full body scan.
Where are you right there?
I'm on deep transverse perineal.
See, and it's hard to identify even as I lay here what specific muscles are being palpated and released. So that's funny. I definitely thought you were in 3rd layer.
Oh, yeah.
That's funny.
That's funny.
But now I can kind of, now that you've said that, I'm like, okay, I'm there.
I know, hard to feel it on ourselves.
Yeah.
Okay, feeling any better? So I'm going to insert a little further here, and I'm going to go into the 3rd layer. So I really want you to focus on that nice belly breathing.
Did you feel me open there?
Yes.
Okay.
That was good. Good.
It's hard.
And it is so hard. Try to keep that opening going. Good. On that inhale, kind of bring your attention down to your pelvic floor and see if you can open your pelvic floor as well. Bringing good blood flow to the tissues and the muscles here so I can get at them. Okay. I'm right on your coccygeus muscle. How's that guy feeling?
It's crazy. It's pulling on my bladder.
Is it? Oh,
Yeah.
okay. Okay. I'm just going to hang out. You just keep breathing. Unclench your whole body.
Okay.
Relax your butt. Relax your inner thighs. Good relaxation.
It's giving me for sure definite urgency. Like it makes me feel like I
Is
have
it?
to go pee right
Okay.
now, even though I
Okay.
just emptied my bladder before this.
Yeah.
So these can be common referral patterns for which patients, anyone can be experiencing. So that's why a lot of like urge incontinence. So if you always have to go to the bathroom, or you go more frequently than like 8 to 10 times a day, but it's in a good way.
Okay.
Like it's not painful. It's just that urge. It's reproducing that symptom.
How are you doing?
Good. It's kind of like going up to my ovary as well.
Okay. And your hips and your abdomen. Are you getting any sense of heat or burning?
No.
No. Okay.
The reason Dr. Riley asked that is because when you start to release the fascia on more of a fascial layer of the pelvic floor, which is just like a fancy word for a sheet that covers your pelvic organs and covers the muscles. When you release that, sometimes that can give you a burning sensation, or we can feel heat when we release certain areas and hold for substantial amount of time. So that's the fascia letting and restructuring.
Okay, I'm gonna come to another muscle over here. Just keep that belly breathing going. Good. How's that guy right there?
Tender.
Tender? Okay.
Really tender.
I'm just gonna hang out. You focus on your breathing and bringing air down into that pelvis. Good. Relaxing your pelvic floor.
I wonder why this side is so
Interesting. Good. Your sensations faded at all?
Yes.
Yes?
They
Okay.
just kind of like go.
Wonderful. I'm gonna keep moving over to another muscle here. Applying a little bit of pressure. How are you doing with that guy?
I mean, it's intense,
Okay.
but it's good.
Okay. Any referral pain elsewhere?
I don't even know where you are, and I can't tell you where it's going.
Okay. No worries. I'm right on pubococcygeus.
It's definitely tender.
Okay. Okay.
even as a patient, we ask these things, and it's hard to explain often, what you're feeling. You can feel things releasing and things moving, and that part is relieving. Sometimes when it's like pulling from different areas, it's really hard to like tell where in your body it's pulling from. And that's okay. That's why we ask a lot of questions and try and differentiate. And the reason we ask is because it helps guide us in where we need to treat and where we need to focus in order to help balance the pelvic floor, balance the tissue. The goal being that you can have improved coordination, improved pelvic health, and improved core strength. So once you get the coordination, then the piece of the puzzle is to like add strength onto that. And we're not just talking Kegels, we're talking like in the form of squats, in the form of jumps, in the form of running, in the form of other things, but having your pelvic floor be coordinated. I'm saying coordinated so it contracts, relaxes, and bulges for many activities, because that's what a healthy pelvic floor should be doing for you.
Is the spot faded in tenderness?
Yeah,
okay.
And then I got going on my soapbox, so I fell off my...
Yeah, it's all right.
Focus on
Hop back on the breathing.
Okay, here we go.
Okay, how's this guy right here?
It's not as bad.
Okay, great.
Where are you there?
Pubic rectalis.
Okay, that's more like flickering.
Okay.
Is that a word?
That works. I'll take it. I'll take it. Flickery. And then the last muscle I'm going to check over here is one that attaches to the outside of your hip. So you're going to feel me kind of turn my hand here, and I want you to really focus on that breathing, trying to relax the pelvic floor. Good. It's a muscle that sits up on the wall of your pelvic floor. And to check that I'm on it, if you could push out into my hand out here.
So tender.
Oh gosh, yeah. Good. Is it okay right there?
Yeah.
Okay. I'll just hang out. You just work on your breathing.
I swear the last time you checked my operator, it wasn't this sore.
Yeah, I know.
This is pulling on my bladder so much.
Really? Okay. And that was the same with that coccygeus muscle.
Yeah. I mean, I increased my walking quite a bit.
Okay.
I haven't the last few days, but maybe that's why. And I'm just getting like way more. And you also haven't treated me since I was in that little fender bender.
True. That's a good point. It's been a little bit.
Yeah.
How's that spot doing?
It's like pulling all over.
Oh, okay. Right up the front.
Mm-hmm.
By your pubic bone.
I'm going to try and relax here.
Yes, good. Good. Just a reminder to unclench your butt, relax your legs, relax your whole body. I'm going to check another point on the same muscle. Is that guy just as tender?
Yeah.
Okay. Okay. Let me know if I need to back off on my...
No, it's
pressure.
good.
Okay.
That one's less bladder referral, but
Okay.
still like really tender.
Okay. Let me know when this one fades.
It's not really going anywhere.
Okay. I'll keep hanging out. Just trying to get it to relax and release. Good.
There, that helped.
Wonderful. Yes, I could feel that opening of your pelvic floor when you did that nice inhale. Yes.
Okay.
Good. I can feel it melting under my finger. Good. Okay, you're going to feel my finger turning here, and I'm going to let off some of the pressure. And while I'm in this layer, I'm going to ask you to do a Kegel again, to do what you think a Kegel is, or a contraction of your pelvic floor for me. Wonderful. That was a great lift. And then relax for me.
Can you feel my bladder coming up?
Yes.
Okay.
Yes. And then if you could bear down or push out like you're going to pass gas. Great. Good. And that was wonderful. That I like that you tried to coordinate that at the end of your inhale into your exhale. That was great.
I'm going to do one with independent of my breath here.
Okay.
Yeah, I feel that much more personally
You feel it more when
when I'm not at the top of my inhale.
Interesting.
So I need to practice that.
Okay.
And so a good time for me to practice that would be with my bowel movements.
Yes. That's a great time to practice. Good. Cool.
Okay.
Cool. Okay, wonderful. So I'm going to have you take one nice big belly breath in for me. Good. And then a nice relaxation. Good. And then another inhale, and on the exhale, I'm going to exit. Okay? Wonderful. Great job. How are you feeling?
Good. So now Dr. Riley would switch to the other side, or we would switch to the other side, check the other side. But that is what a pelvic floor assessment looks like here at Body Motion Physical Therapy. Occasionally we're checking for different things and different sensations, so our words change and the feedback from patients changes. I tried to give you guys some of exactly what I was feeling. Everyone's going to have a different experience with that. But I hope this was helpful, and I hope this helped give you guys some some insight into what it looks like to have a pelvic floor. And thanks for tuning in, even though we are fully masked and we distance from each other. All right, take care, guys.